morning. I hope it is streaming fine, right? You have any issues with the voice, do let me know. So today we shall have these image-based questions. I have put up 10 images, right? So try to identify the images, right? So you'll try to complete off as fast as possible, 15, 20 or maximum of 30 minutes, okay? Good morning. Hi Shivaranjani, Srish, Regina, hi Purvel. Yes, hi Abhishek. Right, so we'll start off with our first image. So identify the image which is being shown on screen. If you want, I'll just zoom in. So identify this image. Hi Saiga, Ritu, good morning. So identify this image. Hi Dhanlakshmi, good morning. Hi Shoaib. Yes. So this is an interdental brush, Proxa brush, right? Also called as Proxa brush. Good. So we'll proceed with the second one. So identify this image. Blue colored wrap-like structure. Yes, Regina, it's an interdental brush, Proxa brush. Good, it's a physical restraint to limit the freedom of movement in order to facilitate treatment. That's true. It has a specific name. I mean, if I give you options, obviously you're going to answer it. So we shall do it without options. It has a brand name. It's called by a specific name. Pedi-wrap. Okay. It's called as Papoose boat. P-A-P-O-S-E. Papoose boat. Yes, Abhishek. Good. Yes, Shoaib, it's Papoose boat. Right. So it helps in limiting the freedom of movement, facilitating treatment, right? Now, the third one. So identify this image. You might have seen this image in the latest edition of Cohen. It's not mentioned in Grossman though. By the way, I gave you a hint. The Shivaranjani is apex located. You can see electrodes, an additional tip, and also you can see some readings here, digital reading. Hi Ravina, electromagnetic scalar. It seems to be like a scalar, but it's not a scalar. Yes, even electromagnetic scalar has a similar appearance, but not the same. Yes, it's a pulp tester, electric pulp tester, EPT. Vitality Scanner is the name of a brand manufactured or distributed by Sibron Endo, right? So it's a electrical pulp tester. Good. Next one. So identify the structures which are being represented here. You can see arrows pointing out towards two foramens, left and right. So identify these foramens. So middle cranial fossa, inner aspect. If you want me to zoom in, I can. I'll give you a hint. It's present in the body of sphenoid. It's present in the body of sphenoid. Foramen ovalian spinosum are present in these areas, and you can visualize them from the basal, from the base, right? From the base of the skull. It's from the inner aspect, the middle cranial fossa. Yes, sure, Ranjani. It is foramen rotundum. Also, the shape of the foramen helps you to identify to some extent. So present in the body of sphenoid, right? Yeah, this is foramen rotundum. Okay, right. She'll definitely incorporate discussion of foramens in one live session, right? Yeah. Next. So identify the structures which are labeled in red. So identify the structures which are labeled in red. This area. Frontozygomatic suture. I mean, you can see a bony process is being highlighted here, a bony extension. If it were a suture, it would have been marked in a thin, in a thin line, right? Anyways, well tried. Okay, do you want me to give the answer? Hi, goodness. Good, Abhishek. Impressive. Zygomatic process of frontal bone. Zygomatic process of frontal bone. Right. So now let's move on to the next one. So identify the anomaly associated with. Okay, I'll just try to find out the organ here. Related to heart tissues. So you can see a 1-1, a discoloration relation to 1-1. Yes, internal resorption being manifested clinically as a pink tooth of mammary. Yes, internal resorption. Good. Yes, pink tooth of mammary. Right, good. Now, observe these radiographs carefully. I'll zoom in to the maximum extent possible. You can see in the first radiograph, one second, I'm sorry. So this is a lower first molar. You can see, can you identify that radio opacity which is being represented by arrow? Here you have an arrow. Can you look into that? Is it visible for you clearly? I'll just zoom in once again. So identify the radio opacity which you see in the canal. I hope you can see now. You can see the canal is being obturated. There is over obturation in relation to distal canal. And mesial canal, if you can see, there is a more radiopaque structure, which is more radiopaque compared to your gutta percha. Good. It's a separated file. Well, you identified it good. So it's a separated file as you rightly mentioned. Now, I'll just move the image. So can you identify in which canal it's present? Where do you see that separated file? Where do you see that separated file? In relation to which canal? Is it because in a mandibular molar, mesial you have mesobuccal and mesolingual, right? So in which canal do you find this separated instrument? Mesolingual? Well, we'll look into a corresponding image related to the same anomaly. Now you can see clearly that mesolingual canal is having this separated instrument. Now, you can see two radiographs here representing two different horizontal angulations. So what does this technique represent? So what is this technique of taking two radiographs at different horizontal angulations in order to identify the position of a foreign object? Or it can be any anatomic structure. So what do you call this technique? So that's the question. Because when you are moving to the same side, if the structure is present lingually, it moves towards the side of the cone shift. So that's the question. Good. It's called as slope. So what are the different names for this technique? So what are the different names for this technique? So it's called as Slope's rule, Clark's technique, tube shift, or object localization. So it's also called as object localization. Good. So you're all very much familiar with that, which is a very good indication. Right. Now let's move on to the next question. So what does this image represent? What does this arrow represent? Yes, Deepak and Shoaib, what is Walton's projection? So the amount of horizontal overlap is nothing but your over jet. The amount of vertical overlap is over byte, isn't it? Very simple. So this image represents over jet. So identify this image. We have discussed the same in our e-classes and also in one of the YouTube videos. So what does this image represent? Okay, Walton's projection. I don't remember. Good. It's an X-ray tube head. It's an X-ray tube head. You can see a target being inclined at a specific angle. So you'll have your cathode on one side, anode, and then a vacuum, your glass case, which is having no gas or no air. Right? So this represents your X-ray head. You can go through the video, the components of X-ray tube head, which I posted in e-classes and YouTube. Right? We discussed in detail the X-ray tube head. Last one, I reckon. So identify or the following tooth, 6, IOP representing lower first molar, represents a case of primary endo with secondary perio, primary perio with secondary endo, concomitant lesion or combined lesion. So you have Simon's classification of endoperio lesions, right? So which classification or which category does this radiograph come under? Obviously it's an endoperio case. I want you to give me like specifically whether it's primary endo or primary perio, or secondary endo or secondary perio, or is it true combined? So you can see, I mean, I'm not giving you any clinical information or the vitality aspect, but as you can see, based on radiograph alone, in fact, that should not be done clinically, right? So based on radiograph in this case, you can see loss in continuity of your enamel. So there seems to be some decay, right? Radiolucency associated with your enamel dentin and approximating pulp, and also you can see associated periapical changes and also furcation radiolucency, right? But in general, overall, there is as such no horizontal bone loss, right? So, I mean, nothing to do with perio, but primary endo leading to, you can see here periapical radiolucency spreading along the lateral aspect of the root, and also you can see furcation radiolucency, right? So it's involving periodontal structures secondary. So it's a classic case of primary endo with secondary perio, right? Good. Primary endo with secondary perio. If at all you find bone loss and all, we have different kinds of lesions. We'll have separate discussion on this topic later, right? Yeah. It's a classic case of primary endo, secondary perio. Without decay, it depends on the radiograph, right? It depends on the radiograph. Good. So I think here we complete our 10 questions. Identify this place. We'll stop with this. Yes, Regina, go through endoperio lesions. Okay, you have various radiographs given in a gross net. You'll have in-depth idea like what are all the endo changes and perio changes depending upon the classification. Yes, we have to evaluate for vitality of your tooth, clinical signs and symptoms, and also periodontally we have to evaluate mobility, pockets, sinus tract if at all present, various other characteristic features. Yes, Abhishek, we'll just have a review of all the images once before we conclude. By the way, what is this place? Deepak says Switzerland. Dhanlakshmi says Japan, Hitachi Park, Japan. Yes, Bernice, definitely. Hyderabad. Okay. How many of you have seen a movie called I? Shankar's movie I. Options for this? No, it's difficult. Okay, let me give you options. India, Pakistan, Bangladesh, China. Not I, but alphabet I. It's a Red Sea in China. Panjin, name of the area. Red Sea, Red Beach, China. Okay? Right, we'll just go through all the images once and for all. So you can see proxa brush, interdental brush, right? Let me just zoom in, that will have more clarity. I hope it's much more clear now. Right. So first we have gone through this proxa brush or interdental brush, right? So you can see the head of the instrument. Device used for cleaning your interdental spaces. Next, Papu's board for restricting the freedom of movement, especially in children, to facilitate treatments, right? Papu's board. So this is vitality scanner used for electrical pulp testing, EPT. So foramen rotundum, as you all rightly identified, the greater body of sphenoid. A body of sphenoid, right? To being represented by red arrows. Now, I asked you to identify the shaded areas here. So it's a zygomatic process of frontal bone. Pink tooth of mammary in relation to 1-1 internal resorption case, right? So this is a slop rule. These images represent a slop technique. You can see on the right side there is overlapping of mesiobuccal mesolingual canal. So the X-ray cone has been shifted distally. As a result, you can see the separated instrument moving towards the shift of the tube. I mean, in the direction of your tube. You have shifted your tube distally. The separated instrument seems to be shifted to the same side, right? So that's why you say when it moves to the same side, when a structure moves to the same side of the tube, then it is present lingually. Same side lingual. If it moves in opposite direction, it's present buccally. So that's how we identify, right? So here a separated instrument is present in the mesiobuccal canal. Mesolingual canal. Mesolingual. If the object moves in the direction of your tube shift, it's present lingually. If it moves in opposite direction, it's present buccally. You can see here. So this is the initial radiograph taken. When you've taken another radiograph with different horizontal angulation, when the tube is shifted distally, you can see the separate instrument moving towards the same side, right? Same side lingual. We discussed the same in detail in our E-classes also. Please refer to oral radiology section of our E-classes, right? Yeah. I've given you few illustrations as well. By the way, in the process also have identified very well the separated instrument, which is having marked radio opacity compared to your gutta percha, isn't it? Yeah, good. Now, so this image represents a simple case of overjet. This is your X-ray tube head, and this is a case of primary endo with secondary perio, and this is of course Red Beach in China, right? So we'll stop it here. So few image based questions for this session. We'll go through a virtual classroom session again this evening, right? Either textbook discussion or important points pertaining to NEET MDS. So we'll go through it this evening at 8 p.m. again, right? So if you have any questions further, drop them at proudtobedentist@gmail.com. So it's 26 minutes. I'll share the soft copy of this file in our Google group, right? Yeah. As I keep on saying, I'm standing here, getting up early in the morning, switching all the lights. You can look at my face, the expression of my face. It's really uncomfortable to some extent, frankly speaking. But you can see my student who is really enjoying by sleeping right next to me in the beanbag. And he's even making sounds, which is really annoying me. Toffee, what are you doing? Toffee, say good morning. Say good morning. Hi. Okay, chalo, sleep. Okay guys, right? See you again tonight, 8 p.m., right? With one topic, or we'll go through several topics as we have done yesterday, right? Yeah. Bye. Take care.